We're beginning with a possible case of Ebola in the biggest city in America. A doctor in New York who treated Ebola patients in West Africa became ill today and has been admitted to a hospital. Our chief medical correspondent, Dr. Jon LaPook, is here. And John, what have you learned?
Scott, we should emphasize the patient is awaiting test results, so we don't know if he has Ebola. What makes this different from other cases that have turned out to be false alarms is this patient reportedly returned from West Africa in the last 2 weeks. That's the time symptoms most often start to appear, and tonight he is showing some of those symptoms.
The doctor, Craig Spencer, had returned from Guinea after working with Ebola patients for the aid group Doctors Without Borders. The New York City Health Department said he had a fever of 103 and gastrointestinal symptoms. He contacted officials and isolated himself. This video, shot by the New York Post, shows Spencer being taken from his apartment in Manhattan to Bellevue Hospital by a specially trained unit wearing personal protective equipment. Bellevue is the designated Ebola treatment center in New York City. The New York City Health Department is investigating everyone the patient had contact with to identify who might be at risk. Doctors Without Borders said he followed their protocol for returning from Ebola assignments, saying in a statement, the individual engaged in regular health monitoring and reported this development immediately.
The hospital is saying we could get results as early as this evening.
John, how does this compare to that troublesome case in Dallas?
Scott, it could not be more different than the case in Dallas, where Mr. Duncan walked into a hospital that really wasn't prepared for somebody with Ebola. This man is a physician. He was self-monitoring, and reportedly, as soon as he got symptoms, he put himself in isolation. He contacted the people who needed to send help, and then he went to Bellevue, which is a designated Ebola center in New York, the center, and they've been specifically training for this for weeks.
John, thanks very much.